So now you have your disclaimer. If I swear, that's okay. If you swear, it's on record, just for the record. All right, so we're going to vagus today. So by a show of hands, how many people have heard of the vagus nerve? Yeah, great. Vagus nerve, VAGUS, not Las Vegas. A little play on words there. So the vagus nerve is cranial nerve 10. All of our cranial nerves originate somewhere in our brain. They go to somewhere in our body to do certain functions. Vagus in Latin actually means wandering. So it is our wandering nerve. It is the longest cranial nerve in our body. It goes all the way from our medulla oblongata in our brain through the colon. So we're going to start off with a little anatomy and physiology. What is it? What does it do? What are the different organ systems that it innervates and communicates with? The importance of starting there is number one, so you can see the grand behavior that it has in the body and how many different places that affects. And as you do it, I think it's pretty hard not to sit there and check box in your own self. Oh yeah, I have dysfunction there, or I could optimize this health. So making sure that we kind of take note of, as I'm listing through things head to toe, what it helps and what it supports. You can also then pretty much assume what the dysfunction would be if it's not operating well. After that, we're going to talk a little bit about what stress is. Then I want to talk a little bit about what our human response is to stress. We'll dive into the polyvagal theory a little bit. And at the very end, I'm going to talk about actual ways we can start to really influence, like the title says, how do we rewire and how do we influence our brain in times of stress, so we can modulate that vagus nerve. Important to know why we need to start with. So again, our nervous system is broken into two different parts. We have the somatic nervous system, which is our voluntary nervous system. That's going to innervate our musculature, how we move, how our muscles move. And then we have our autonomic nervous system. This is traditionally known as our involuntary or automatic nervous system, innervating our heart, lungs, digestive tract. That's broken into two categories further then, our sympathetic nervous system and our parasympathetic nervous system. In short, that sympathetic nervous system is our fight or flight response. The parasympathetic nervous system is the rest and digest. And we're going to get into that a lot more when we talk about the stress response. Back to the vagus nerve though, the actual physical nerve, there's two of them. We have two parts to the vagus nerve. We have the right and the left, or the dorsal and the ventral, however you want to talk about it. Again, it originates in the medulla oblongata and travels all the way through the body, all the way to the colon, our long wandering nerve. Its sensory functions go to the ear, the tympanic membrane, the external acoustic canal, and a little patch of skin behind the ear. It gives sensory to part of our taste receptors in our tongue. It gives sensory information from the pharynx and our throat, our esophagus, our trachea. So if you have a sore throat, your gag reflex, all of these things are based on that vagal nerve response. And then it also receives information from our lungs, heart, and GI tract. My stomach's full, stretch receptors. My heart is beating fast. It's going to send a response back to the brain. My lungs are irritated. I have an upper respiratory infection. That kind of discomfort is going to be sent through the vagus nerve back to the brain in a sensory manner. The motor effect of the vagus nerve, what it's innervating, what it's causing an effect to, is way more broad, right? We have the motor muscles of our pharynx, our larynx, our soft palate, and our epiglottis. So you think of dysfunction there, hoarse voice, right? Difficulty swallowing, the gag reflex, chewing, peristalsis, how we move food from our mouth down. And our GI system, the esophagus and the stomach, it's going to support salivation, secretion, peristalsis, which is that movement of food down, bile production. And we're getting into now the intestines, liver, gallbladder, pancreas. It's going to help innervate bile production, pancreatic enzymes. The bladder is going to talk about the bladder smooth muscles and contractility. It also helps control erections, ejaculation, in the reproductive system. For our heart, the vagus nerve is going to slow. It's a negative chronotropic effect on our heart. It's going to slow your heart rate down, and it's going to dilate your lung tree. It's going to dilate that and allow for more oxygen exchange in that way. So secretion of our lungs as well, the secretory fluids that our lungs make. It also is going to innervate our kidneys and our adrenal glands. So as we're going through that kind of top to bottom through our digestive system, intestines, colon, you can start to see that this vagus nerve is really responsible for everything in our body that we need to thrive. right? Not necessarily survive. I mean, we definitely need all those things to survive, but thriving in our health is modulated by this vagus nerve. We talk about dysfunction of it is going to be like pain, unusual heart rate, blood pressure that's really hard to control. I can't tell you how many times I have people come in with hypertension and they give me their blood pressure logs and there are 2 or 3 antihypertensive meds that they're on. They're like, I don't know, it's not working, it fluctuates, I go high to low, there's nothing else going on. And I'm going vagus nerve, vagus nerve, vagus nerve. What's happening here is because we're sending haywire messages back and forth, and that heart rate and blood pressure are directly affected by it. If you want to get really far in the weeds, and I won't go too far into the forest, just in the dandelions, we have these carotid sinuses, right? We have these little parasympathetic barometric pressure guys located in our cardiovascular system that tell us what's the heart doing, and it sends messages to the brain, and then the brain sends messages back to say, here's how we need to help support the heart in its current system. Another really interesting part about the vagus nerve, the right and the left, is that the 2 nodes of the heart, the conduction nodes that keep the pacing, right? Those pacemakers, we have the SA node and the AV node. Those are each innervated by different branches of the vagus nerve. So if you have vagal nerve dysfunction on one side or the other, you're going to see different symptoms in your body. You're going to see different physiologic effects in the body. So you can't really just say you have vagal nerve dysfunction overall. You might have right or left vagal nerve dysfunction, and that can be a result of trauma, surgeries, whiplash, different things that have happened in your body can affect one or the other. So some other digestive symptoms that you might see based on what it's innervating: gastroparesis, decreased hydrochloric acid in your stomach, nausea, vomiting, bloating, pain, acid reflux. So again, I can't tell you how many times I have people in my clinic, in my practice, that are like, here are my symptoms. It's not going away. Nothing's working. So when we talk about this puppet master of our physiology, that's why I call it that, because nothing is going to work if we can't get into that parasympathetic nervous system. If we're not really getting to the root of how our physiology was designed to work, then a lot of these adjunctive or medicinals, whether they be natural or pharmaceutical, are not going to be effective because that part of the body is dysfunctional and that nerve is responsible for that innervation. So that's kind of just a quick introduction into like the anatomy, physiology of what is the nerve, where does it come from, where does it go, and what are the different organ systems that it innervates. This is a great time for anybody, if you want to share, to unmute and ask a question. Just raise your hand first if you have your video going, or just talk, and we can go in turn here. So does anybody have any questions on that part of the segment here? No? All doing good? Okay. My chat box isn't showing. There it is. Okay, so now I have my chat box up. Just so you know, you can send a message. If you click on everyone, you can send a message to just me if you don't want anybody to see it. Otherwise, you can send it to everyone in the meeting, and I will address those questions as they come in. So the next thing I want to address is stress. What is stress? Does anybody have any ideas of what the definition of stress is? Anybody want to play along? Oh, you guys, you do this to me every time. Nobody wants to participate. That's all right. Turns out I came with one. Go ahead, Don. Thank you.
I would say emotional overload.
Emotional overload absolutely is a form of stress. Would you call that distress or eustress?
Probably distress.
Distress, yeah. An important question, right? Everything that comes our way, I don't know if anybody's familiar with Viktor Frankl. He's a Holocaust survivor. If you haven't read him, I think it's everybody's moral human responsibility to read his work. Just for the record, I'm very biased. He's a Holocaust survivor. He's a phenomenal human. I call him my bestie. If he was alive, we would be best friends, and he would be my life coach. But he is the one who really claims, him and Hans Selye, and that in between each stressor, each insult, right, and each reaction is a pause. And in that pause, we get to ask the question that I asked Dawn: is this good stress or bad stress? Is this eustress or is this distress? A lot of what we're going to do today, a lot of the end of my presentation is going to be, how do we do that, right? It's really easy for me to say, hey, in between each insult in your day, if you can stop and expand the pause, that'd be great for your nervous system. But that's not how life works, right? We get blindsided, we get overwhelmed. We have no idea when our bucket is going to be full, because no one can dissect us and tell us, here's your bucket, and you're right there brimming at the top, right? We don't know when that's going to happen. What is important is to introduce the question into your awareness. Is this good stress or is this bad stress? So stress, somebody else wrote here, stress is pressure. Great. I don't know if Stephanie's an engineer or not, but you sound like one. It's absolutely pressure, especially for the engineers, right? Anytime we have pressure elicited on an object in a physical world, right? We're talking about physics. How much pressure can that withstand before breaking? Now, if we're thinking about it physically, is a piece of glass that's rigid and straight going to withstand the same amount of pressure as a rubber tube? You can shake your head. No. Everybody, no, in concert. We're all engineers now, right? That rigid piece of glass is going to shatter under pressure, where that flexible rubber tube is going to adapt and flex and then return to its original shape. A lot of times what you'll see on these resilience webinars or on these pages is the crocus, right? Is everybody familiar with the flower of the crocus? It's my favorite flower because at the end of a long, hard winter, that son of a bitch pops up in the middle of the ice, right? You're like, it's winter and we ever going to get warmth, or we ever going to get sun again? And all of a sudden you're like, boom, purple flower. And it's amazing. And it shows resilience and the ability to adapt and use what's around it. I love the crocus as a representation of resilience under pressure. So that's the very first question. Remember that for later when we're talking about, hey, how do we adapt to this? And that is it good or is it bad? Can I grow from this, or am I going to break under this pressure? And that's that first part of awareness that we're going to work on. So the definition of stress that I really like to use, because it encompasses both eustress and distress, is anything that moves one out of balance, right? Anything that shifts the homeostatic balance in your physiology is going to be considered a stress. And it could be good or bad, right? A wedding typically is good stress. There's a lot of planning and excitement and family and everything coming into it. That can be a good stress. It's still throwing somebody out of balance, but hopefully it's in a positive way for a good result. So that is kind of my idea of stressors. Like, let's introduce the fact that it's not just an umbrella term of stress, that there's actually good and bad types. Now, when under stress, and somebody asked here, Jay, is it a rise in cortisol? Absolutely, you're going to get a rise in cortisol. And I'm going to talk about some physiologic effects here next. So that's a great segue. So the theory out there is that we have 3 stages of response to stress in the body. That is immobilization, mobilization, or social engagement, right? If we are in danger, if we assess that the stress that we're under is dangerous and is life-threatening and we are not safe, then we're most likely going to go into mobilization phase. Does anybody know what that common phrase is there, mobilization? What we use? Fight, flight, freeze. That would be immobilization. Fawn, feigning your death, immobilization. And they just added 2 more. I actually just learned this morning, you guys. It blew my mind. Fornication and food. We've got 2 more Fs. Our sympathetic nervous system, adaptive responses to stress, fight, flight, freeze, or fawn, fornicate, and food as self-soothing coping mechanisms. Pretty phenomenal. We've evolved even since the start of what the sympathetic nervous system is. We just keep bringing on new Fs. And there's a synonym for fornicate that also starts with an F. So whatever makes you remember it, keep that in mind. The immobilization, right? Feigning death, fawning, pretending like it didn't happen. I don't know how many people might be in fawning phase all the time in the last 2 years, right? How many times are you watching the news and you say, you know what? I'm shutting it off. Anybody done that in the last 2 years? I'm watching. I'm just shut it off. Does you shutting it off make it not there? No. That's a type of fawn. You're fine. You're pretending that it doesn't exist. I'm going to play dead. This isn't really happening. It's still a sympathetic nervous system response. It's still a coping technique to the stressor that's out there. If I pretend this doesn't exist, it doesn't exist. That's what you're supposed to do when you see a grizzly bear, right? I'm going to pretend that you don't exist and play dead. That way you'll go away, I think. Or does it get big? I guess it depends how close it is to eating you. But, so these are all the different ways that we can react. Social engagement is another response mechanism in stages of stress where we actually feel safe. And we have evolved, and we're kind of going into the polyvagal theory, we actually have evolved. Our neuronal pathways were not always this way by design. We were designed to not solely survive in safe environments, but to promote survival in dangerous, life-threatening situations, right? Our primitive neural circuits are fight or flight or feigning death. We have actually evolved into this social engagement. We have evolved into needing and being built for connection with other people. That only happens when we feel safe. So now think about this. They've done human experiments with infants, right? Very, very tiny infants and their mothers. So somebody that they feel very comfortable and safe with. And when those mothers are not mirroring, matching facial expression that elicits safety to the infant will burst into tears. I don't feel safe. I'm going to scream at you. That mother in the same video clip can turn around and come back and smile and coo and change her tone of voice and her facial expression, and the baby will mirror it. I feel safe. I will engage with you. This is the very, very beginning of our innate ability to understand fear and danger versus safety and comfort. And it happens at the beginning of our neurodevelopment. So think of now the impacts of childhood trauma. Right? We have more and more research coming about what's called ACEs, adverse childhood effects, adverse childhood events on inflammatory diseases, cardiovascular risk factors, the inability to cope with stress, social engagement, neurodivergent disorders. So these childhood traumas, if safety is never a thing, it's never a place that's familiar as we develop neurologically, then it's going to be a really hard place to tell your nervous system to get into in later years. That's why any of my patients who have childhood trauma, I'm resistant to prescribe something like meditation or mindful breath work, because I'm actually asking their nervous system to go into an unfamiliar territory, which can actually elicit more anxiety. So it's really important to understand how history of trauma and your nervous system response since infancy is affecting your stress response to date. I put this into context with the information about your amygdala, right? Your amygdala is a little almond-shaped part of your brain that's part of your limbic center, that very instinctual, that's what's responsible for fear. It's also responsible for memory storage. It's a subconscious memory storage to keep you alive. So if you are 3 years old prior to conscious memory, and you're walking down a wooded path and you see a snake, and your mom screams and you scream and your life is in danger and you react big and bold, your amygdala is going to store that for later use. Hey, we were in danger. We need to save this exact environment for later on down the road. Now, 40 years later, you're half a country away and you're walking down a wooded path and you see a stick. And you jump for high hills and scream all the curse words you know, and then you feel ridiculous. I have no idea why I did that. Because one, you don't have any conscious memory of this that happened when you were 3. But your amygdala just went haywire. Hey, we know this place, we know this smell, we know that stick, and it's a scary snake. It's there to keep you alive. And thank goodness for it. Because it's one of the most important mechanisms of survival that we have built into our physiology. I used to fly jets in the military, quick snippet of mine, and all of my instructors would say, if the hairs on the back of your neck go up, listen. Before you see, react, know you're in danger by any tangible means, you trust that and you go home. You knock it off, you quit your exercise, whatever the case may be. Because they understood that your human physiology can actually recognize danger before you can, and that's a sign that we need to stop. So it's really important to honor that. Now, it happens when we have a hyperactive amygdala, right? Somebody with post-traumatic stress disorder, somebody with childhood trauma. Anybody who's adulting in the current world probably has an overactive amygdala. There's fear, there's danger everywhere. The last 2 years, it's excessive. It's everywhere we look. There's fear and danger, whether you buy into it or not. This is what's getting thrown our way. So our amygdala is constantly putting these memories into our subconscious bank. hey, this is fearful, this is danger, this isn't healthy, this isn't where we should be, we don't feel right. Now you pair that with, like I said, human responsibilities, adulting, actual dangers and threats in the world, environmental toxins, relationship stressors, financial stressors, anything else that plays a part in this, and we've got a really hyperactive sympathetic nervous system. Hey, we are fighting and flighting all the time. Where that becomes a detriment to us is the concept of neuroception. What I tell a lot of my patients is imagine that your autonomic nervous system is actually a third-party observer, but they are there all of the time and they can read your mind, like Mel Gibson can in that whatever movie. It's literally there all the time, and it's always assessing your safety. That's called neuroception. 24/7, this guy is working. Yes, even in your sleep. Did you guys know we wake up multiple times during the night, assess our environment, and go back to sleep? We have little micro awakes. I thought that was pretty cool. I didn't know that till I had a toddler, and I was like, why is he waking up? And they're like, well, because this is why. So all the time it's assessing it. So not only is it assessing your perceived environment, what's happening in your world, it's also assessing that internal monologue. Oh, I should have done this. I don't like my hair today. I don't like that person. I'm mad at my husband. I'm mad at my wife, right? I don't feel good about myself. I wish I could just lose some weight. That internal monologue, those negative thoughts, it's listening to that too. And it's assessing, am I safe? Is Karin safe right now? She sure doesn't sound safe based on that narrative that she's saying. Doesn't sound safe. We must still be running from the bear. So when we understand that this third-party observer is the most observant part of our being, now we switch this autonomic, involuntary, automatic nervous system. Let's shift the power, right? I disagree with the fact that it's completely involuntary because I can change my heart rate. I can change my perception of safety. I can even change the temperature in my fingertips if I sit and meditate about it by changing the blood flow to that area of my body. And if we have that kind of power over this automatic nervous system, then my question is, why aren't we harnessing this more throughout the day? Why aren't we actually accessing that power all the time? And this is a conversation I have with every single patient that walks in my door, and it's the reason for having this with you today, because I want to take this power out of this intangible, this is part of your body and it just does what it does, so give me some meds to control it, back into, if I understand what it's doing and how to control it and what it's perceiving and how it's getting the information, now I can start to adjust. Now I can start to change my perception. A big thing about neuroception, or that ability to see and perceive what's happening in the environment, is not only what is happening in the environment that would create danger, but it's also our amygdala, our limbic center, can actually compromise our ability to recognize safety even when it's there. So I'm going to say that again. That neuroception is constantly surveying your environment for safety, right? Let's say it's always looking for dragons. It's always looking for demons. It's always looking for danger. When we have a hyperactive amygdala and we're in the sympathetic nervous system, we're actually inhibiting our ability to recognize safety. So the built-in mechanism that when we should feel safe, when it would be ideal to feel safe, is actually being inhibited. So even when we are in safety, we can't recognize it. A really great example I use for this would be the very stereotypical war veteran, PTSD, right? You go through this, you have this traumatic experience, now you're in a safe environment and you see a ceiling fan, you hear a firework. Even though you're safe and you're in a safe environment and everything around you seems like it would be safe, you can't recognize it. You can't actually assimilate to your external environment. And that's where we need to do the work to shift that amygdala activity, decrease inflammation in the body, harness the power of the autonomic nervous system. So that was a lot more on physiology and what our physiologic response to stress is in the body and how to kind of discern what that looks like. So does anybody have any questions about the physiologic response and what's happening in our body? No. Okay, so I do see a message here. Let's talk about how to harness the autonomic nervous system to fight cancer. I am definitely going to talk about how to harness the autonomic nervous system. What I'm not going to do is anything disease specific today, just because I'm trying to speak to a broad audience. Anything disease specific, I'm definitely willing to engage in conversation, either privately through a visit or through email communications or anything like that. We just get very limited time to get as much info out as we can. So the other thing I want to talk about is response to stress. When that nervous system is really engaged, we can have what's called a vasovagal response. Everybody heard of vasovagal before? No? Blood draw fainting, right? Maybe you had an aging grandparent who passed out going to the bathroom. That can happen when we strain passing bowels. It can happen at the sight of blood draws. It can happen at the sight of danger, right? Some people faint at the sight of danger, and standing for a long time. And because that vagus nerve is responsible for that stress response, what happens is a very sudden drop in heart rate and blood pressure, and it causes you to faint or lose consciousness. So if anybody's curious about the word vagus and the vasovagal response, which is a pretty commonly used term, I just wanted to address what that is and how that looks and why it's happening. The other thing that I want to mention is about facial expressions, where emotion comes from. A lot of times emotion comes from what we say, right? I love you. I care about you. I'm mad at you. I hate you. All of those sounded pretty much exactly the same, right? Did you guys get any emotion from what I just said? Emotions come not from what we say, but how we say it. That's what we respond to in the other person. Think about the last fight you had with your significant other, with somebody you're close to in a relationship. Think of all of those situations where, like, I don't think that I believe what you're saying. Those emotions, that laryngeal musculature, if you really want to dive in deep, is innervated by the vagus nerve, which changes how our vocal cords are expanded and contracted to change the pitch of our voice to show whether or not we are safe or in danger. And the person that's engaging with you socially is responding to how you speak rather than what you say. Right? So it's really important as we engage and we're intentional about our relationships and our communication to understand that that's a vagal nerve innervation. How we speak, the inflection that we carry, how we emote through our voice is how we say something, not necessarily what we say. So we talked about polyvagal theory. We talked about stress response. So what can we do? Any questions, first and foremost? Anything up until this point? No, we're good? Everybody's good? Okay, so I want to hit on the cortisol response really quick physiologically. When we were under stress or duress, stress or distress, we send a signal to our adrenal glands. Hey, we're under stress, send out cortisol. Cortisol is our stress response hormone. In small acute periods of stress, which is what we were designed to compensate with cortisol, we actually increase blood sugar uptake from the bloodstream into the cells. Hey, body, we're running from a bear. Send blood to the skeletal muscles, send blood to the heart, increase heart rate, send blood to the lungs, dilate the pupils, and let's take blood sugar up so we can use that for energy, right? Boom, we're sprinting from the bear. We get in our cave. Now we balance out with the parasympathetic safety. When we are in prolonged maladaptive stress syndrome and we continue to send that signal to our adrenal glands and it continues to put out cortisol, what happens is your body decides, in short, hey, we're going to be running from this bear for a while. One, let's hoard. I'm hoarding everything. I'm hoarding nutrients. I'm going to pack it around my midsection, right? That's where we hoard our nutrients, midsection. We're going to keep it all. We're actually develop insulin resistance. So we still make insulin, not as much, because that vagus nerve, which is our safety nerve in the parasympathetic safety nervous system domain, is innervating our pancreas to release its enzymes and hormones. So we're going to reduce that because it's not innervated because we're not safe. And also we're developing a resistance to keep blood sugar in our bloodstream for longer. We're saving up. We're hoarding. We can recognize as a brilliant human design that we're going to be in this state of being for a long time. So when I get people coming into my clinic, I can't lose weight. I'm doing everything. I can't get rid of this weight. What's your stress? Everything. All right, let's start there. because you're hoarding. All of your body is literally in survival mode. I'm not letting go of any of this. I'm going to package it in. I'm holding on tight because I don't know how long we're going to be in this rat race. So it's a really important component of overall health and well-being, metabolic function, metabolic balance, type 2 diabetes. You have an increased risk factor for that with increased stress response. So that's the physiologic response in the cortisol. And somebody mentioned cortisol, so I wanted to hit on that for sure. So how do we harness this? Here's the information that I really want you to leave here with. By design, the human body, every time we inhale passively, right? So keep passively at the front of your mind. Every time we inhale passively, we go into sympathetic nervous tone. Our heart rate increases a little bit, our blood pressure jumps up, our eyes might dilate just a little bit, right? We boop, jump into sympathetic nervous tone. Every time we exhale, we trigger the vagus nerve. We stimulate the vagus nerve and we go into parasympathetic nervous system. So as a living, breathing body in a Buddhist meditation, every time we're breathing, our body is this brilliant mechanism of balance. Can you get more rubber hose than that? Right? This is how we're living. We're breathing, inhaling, exhaling. Here's our heart rate. Now I'm introducing a term called heart rate variability. We want our heart rate to be variable. We want it to be flexible. We want it to wax and wane throughout the day. That's what gives us those quick cat-like reflexes when we need them. If we're stuck up here, we can't do it. If we're stuck down here, we can't do it. Variability. So when you're talking about biofeedback, I'm trained in biofeedback. We measure heart rate variability, plug you up to everything. What is your lungs doing? How are you breathing? Are you using your diaphragm? What's your heart rate variability? What's your temperature? All of these, what's your pulses? All of these give a clue to your resilience or adaptability as a human physiologic being. Knowing that, paired with the information that you can pretty much, they work at the same time. So I don't want to put any false information out there. Parasympathetic and sympathetic can both be active at the same time, but they're opposing forces, right? So think of them more as magnets rather than just one or the other. They're always there. They're opposing forces. So one is playing tug of war at all times. You're going one way or another. So knowing that with breath, you can shift which magnet is dominant. How do you suspect that we hijack the nervous system? Somebody's got to answer. It was a softball.
Exhale.
Exhale. Thank you, whoever that was. Exhaling. We have so much control. Now, there's a lot of practices that we need to do to really retrain the brain, right? The neuroplasticity part of the brain. Think of it this way. The neuronal pathways that your brain follows are similar to walking through the jungle. I had a mentor in neurology. She was a conventional neurologist who switched over to integrative medicine. And she used to give this phenomenal example to her patients, is that every neuronal pathway is like going through the jungle. The very first attempt to get from A to B in the jungle is really hard. You've got trees and limbs and weeds and snakes and all kinds of obstacles in your way to get from point A to B. The next time you go through, it's going to be a lot easier because you've patted down some of those things and you've used your machete and you've cleared out some of the big brush. The third time you go through, now you're just stepping over the little bumble, right? And I have less, let me see here. I want to keep talking, so give me 1 second and see if I can upgrade. Bear with me, guys. I'm pausing just so I can get this going. And if I can't, I have 1 minute and we'll make it quick. The more we use it, the better our neuronal pathways become. Breath work, I really want to hit on this part. 4, 7, 8 breathing multiple times throughout the day. Inhale 4, hold 7, exhale 8. Even if your mind isn't caught up yet to that's where we're at physiologically, I don't necessarily feel safe. I'm not recognizing yet. I'm working there. I'm reading my Viktor Frankl. I'm meditating. I'm doing all the work that I need to do. We can hijack our physiology by extending our breath and putting us into the parasympathetic nervous system. All right, now I'm trying to multitask. It's not going to work. It's going to kick me out. But in the last minute I have here, I hope that this was helpful. I hope that you got something out of at least understanding.
Can you relaunch it? Can you restart it?
Yeah, if you guys stay, don't hang up. You guys stay. Let me take a look here how this works. Did I lose you? Ah, I did it. Now I'm sweating. My sympathetic nervous system kicked in, you guys. I'm here. That's a really good example of it. How can I hijack it in this moment? Right? I can exhale. And I'm going to do that because I need to get my train of thought back into place. Right? Where's the blood flow in my brain going right now? I didn't actually choreograph this, so I'm actually really excited that we just went into this phase while I'm here live, not stressful at all, right? Use stress, I'm learning. All the blood flow in my brain is going to survival mode. It's going to my limbic center. How do we fight, flight, or freeze our way out of this? How do I take action? How do I hurry up and do this? It's going here. Where's all my cognitive and thought processes happening? My prefrontal cortex. How can I rationalize cause and effect? How can I remember that word that I was going to say? How do I remember that guy's name? How to remember what I was going to lecture about? What topic was I just on? I have to shift my blood flow, and we can do that. We can shift it when we exhale. We change the dilation, we change the constriction, we change the actual blood flow in our body to go to different areas. And we've chatted about that a little bit. When we're in fight or flight, I think I hit on it. We're sending blood, nutrients, oxygen to our skeletal muscles, our heart, our lungs, right, to get ready to run from the bear. When we're in parasympathetic nervous system, we're rerouting that blood system when we're dilating blood vessels in our digestive tract. When somebody is here in my office and they're saying, I'm having digestive issues, and I listen to their stomach and it rumbles, I'm like, cool. You were in parasympathetic nervous system for a second. Your body was actually to the point where it's making juices, it's peristalsing, it's moving things around, and I can hear it happening in your body. That's when we get those juices. That's when we get hydrochloric acid in our stomach. I'm up here because that's where we get reflux in our stomach to digest our food. These things don't happen if we're not in a safe place. And I want to come back to digestion because it's so important, and now I have unlimited minutes. So these things are really important. What I wanted to get to with the respiratory concerns, somebody should have thrown something at me and been like, you were mid-chat about 4-7-8 breathing. Dr. Andrew Weil talks about 4-7-8 breathing. He patented the thing. I don't know how you can patent breath work, but he did. And it's, putting your tongue up on the roof of your mouth behind your teeth, inhaling for 4, holding for 7, exhaling for 8. According to the polyvagal theory, right, we're exhaling twice as long as we inhale. Therefore, we should be resetting that nervous system balance into parasympathetic. And it works. And I'll tell you when to do it. It's not in times of stress. If you want to rewire your brain and your nervous system, you have to do it when you're calm. You have to do it when you're safe. You have to educate and introduce to your brain, this is what it looks like, in a space where it's not going, holy shit, I don't know what that looks like, and I think I just need to hyperventilate. Because that's what we do. And even at resting, it's been shown that most humans hyperventilate. An optimal breath pattern for a minute is 6 breaths a minute. Time yourself when we hang up. How many breaths am I taking in a minute? It's probably 12 to 15. That's where most people are at least double the normal oxygen respiratory rate for normal physiology. Optimal physiology, right? We want to really take those nice deep diaphragmatic inhales and exhale all the way and find that balance between the sympathetic and parasympathetic nervous system. So,
I have a question on that. So what's the breath pattern when we're sleeping? Is that I heard it was shorter, quicker breaths.
It's going to be, yep. So your whole metabolic rate when you're sleeping is going to shift. I tend to tell people when we have healthy sleep patterns, you're essentially an alien, right? Your heart rate drops. You're just barely above the living threshold, which is how it should be. Your whole body drops out of consciousness and barely uses the metabolism necessary to keep you going when we're in a healthy sleep pattern. And that's the best place for your brain, actually. We have, I call it new-ish research showing that your brain has its own lymphatic system. its own detox, its own flush. And they called it the glymphatic nervous system, or the glymphatic system. So in your brain, we have little lymph valves that drain toxins from it. So that's another thing that happens when it sleeps, when we sleep. So yes, you're right on that. Conscious passive breathing is where I'm talking about the pacing there. So really good question, Ben. And to jump on this really quick, distress and eustress. Eustress would be EU stress, and distress, DIS stress. And it's exactly how it sounds. Distress would be bad stress, harmful stress, and then eustress is good stress. And it might have been before you signed it, but like a wedding would be eustress, right? It's stressful, hopefully in a good, positive way. So back to the breath work. When we start to implement that breath work, and as a prescription, I write it every 60 to 90 minutes throughout your waking days. I want you to do 3 to 5, 4, 7, 8 breaths. So many times throughout the day, in times of calm, you're actually rewiring your nervous system to say, exhale, exhale. We haven't been in parasympathetic nervous system for the last hour, the last 2 hours, the last 3 hours. Exhale. Whether or not you've gotten there yet, intentionality, you're hijacking your system. I can't give you an easier hijack than that, because you don't even have to be fully present in it for it to work, because it's physiologically doing the thing that you need to be done in your nervous system. It's balancing you out. I like to use a lot of metaphors. The one that I use most often is trampoline, right? Everybody been on a trampoline at least once? You know the concept of a trampoline? Yeah, nodding, engaging. We're here, we're not frozen. Awesome. Bobbing heads. So idea of the trampoline, right? Let's think of that as your nervous system. You wake up in the morning, you're just laying on the trampoline. As soon as you open your eyes, what happens? We start bouncing, right? What do I have to do today? What am I going to have for breakfast? Here comes the day. Boom, we're bouncing. That's your sympathetic nervous system, bouncing on the trampoline. Now, as the day goes on, that bounce, right? We just gain momentum. We're just going to, the longer you bounce on that trampoline, the higher you're going to get. And then people come to me and they say, Matt, it's time for bed. I watch the news, I brush my teeth, and I can't fall asleep. What's going on? Well, you've been bouncing on a trampoline all day. And now you want to tell your brain, shut off? It doesn't work that way. We're supposed to be in balance. So unless we stop the bounce, whether intentionally and fully present, or we hijack the system multiple times to remind our biofeedback system that this is the other phase we need to exist in, we're going to be really, really high up in the air by the time it's time to come down and go to sleep. And can you imagine if you're actually on a trampoline and every hour you stop the bounce? Every hour you just stop down for a couple seconds and then you say, how long is it going to take for me to get up that high again? Right? And then you start bouncing again. You're not going to get as high. It's not going to be as intense. And now you're going to start balancing out that threshold. And now we're finding heart rate variability. Now we're increasing that flexibility and adaptability for our nervous system to exist in the day with these stressors. So I love the emotional overwhelm was the very first answer to the question of what is stress. I love that because emotional overwhelm happens when our buckets are full, right? Our buckets are full. Now we feel overwhelmed. I can't handle anymore. I'm either going to have a panic attack. I'm going to shut down. I'm going to snap at my significant other. I'm going to hang up the phone. I had a patient in here the other day that literally stomped on a pen because it fell off the table. Just hated the pen, fell off the table. These are common human responses to stress when your bucket is full. But what if 6 or 7 times throughout the day, you dumped a little out? Or you took out the stopper. You said, now those moments where something happens and someone cuts you off in traffic, they must be having a really bad day. I bet they're in a hurry. I'm so glad that I'm safe today, right? We actually allow space. Now we're talking full circle, right? Again, I didn't document this, you guys. This is happening. Now the space is there that Viktor Frankl's talking about. The thing happened. Now we create the space because our buckets aren't full to say, was that good stress or bad stress? Am I safe or am I in danger? I'm actually not in danger. Thank goodness that I'm not. That person could have hit me. I'm glad everybody's okay. rather than if you live in Seattle, hey, you know, here comes all the birds. So it all goes together. It all marries together. And now we talk about immune system, huge component of topic right now. We actually know that when we're in that maladaptive stress response, when we're chronically under that sympathetic nervous tone, we actually shift our immune cells from one form to another. We come out of viral toxicity, the NK cells, and we drop out of that. Our immune system deteriorates with chronic stress. Think of it simply. We only have so many resources in our human physiology to dedicate to different functions in the body. Now, they don't just stop. Adrenal fatigue is not a thing. It's not a diagnosis. Your adrenals don't fatigue. Oh man, I'm really tired of being Karin's adrenals. That doesn't happen. But what they do is they use resources in the body that's dedicated to support their physiologic function. And when those resources are diminished, when we're not making digestive juices to break down our food to give the micronutrients and minerals that we need then to build up neurotransmitters and hormones and everything else in our body, because we're not in parasympathetic nervous system, so we don't get optimal digestion, we don't get optimal absorption. Now we don't have nutrients in our bloodstream to feed these end organs. They're not going to work up to par. Nor can we make new immune cells or mount an immune response. All of these things are tied in so closely together, and the common thread between all of them is the long wandering nerve that goes from head to butt. And that's your vagus nerve. It's everywhere. And it's so explicitly important in all of health. And I talk about this all the time. It's not just what you eat, right? It's what you eat, what you absorb, what you digest, what you metabolize, what you deliver, and then what do you receive? Just like we talked about before, you could be in a safe environment and not even recognize it because you're inhibited. You could take a medication or a natural medicine and not receive it because your body's not in a place of safety and it's not going to be as effective as it is. Or is it meant to be at that dose? So it's a living, breathing, changing, flexible, adaptive organism that we have tried to boil down into multiple systems that need to operate like heavy machinery, and it just doesn't work that way because we're always responding. We always have this third-party observer that's responding to every environment, every thought, every scent, everything. It's everywhere. It's responding all of the time to what situation we're in, and then it's telling our body, here's how to react. And that knowledge, hopefully, is there to empower you to say, oh, I can shift this. Until I get there fully, damn it, I can exhale. Right? We all can exhale. We can all do some breath work. We can all hijack the system to introduce it gently. Hey, body, did you know we can do this? Did you know we can get into this nervous system tone? For a few seconds a day, I want to show you what that feels like. And we're going to start trudging through the jungle. And the more time you do it, by the end, you have already run a lawnmower through and you're running through the jungle like, hey, this is my nervous system response. And what people will tell me, I mean, I've experienced it, but I don't want to be biased here. What patients will tell me is that in times of stress, here is my normal response. Right? This is what we do. We hold our breath. Inhale sharply, hold your breath, clench your fists. Everything goes up. All the sphincters close, right? Almost, I'm not pooping, I'm not peeing, nothing's happening. And it physiologically happens and you can feel it. Everything's tight. Oh, I have muscle pain. I get headaches, tension headaches. This is times of stress. Practicing this in the biofeedback mechanism to which it's designed, trudging through the jungle. Oh my gosh, my daughter just gave me this insult and I went, melted. Well, that didn't feel good. My response is to come back into, am I safe? Can I ground myself? Can I expand that pause and choose what my physiology does? Being proactive instead of reactive. Any questions? Thoughts, concerns, complaints? Sorry about
when you had talked about every 60 to 90 minutes for, was it 5 to 7 sets or?
I usually say 3 to 5 sets.
Okay.
To really gather compliance, to be honest.
Good.
If you want to do 5 to 7, I mean, the more you do it, the more you're going to enforce those pathways. If you're starting a new habit, start where you can. The frequency throughout the day is the most important part, right? Because remember the trampoline. Even if you do one breath 10 times a day, you're pausing that trampoline for a hot second. Anything else?
How would you recommend, let's say you're working with somebody and you want to get them from a sympathetic state into a parasympathetic state? The breath would be a good pathway, because you were saying, you know, don't do the exercise when you're in that sympathetic state.
Right. Ideally, when you're introducing your body to this new state, it wouldn't be in times of stress, because it can elicit some anxiety, to be honest. It can elicit, like, I can't go there right now. I'm anxious. I'm already in sympathetic nervous system. The goal is to create that neuronal pathway, so then when stress occurs, that's the adaptive response. If somebody's in it right then and there, it's totally safe to say, hey, would you like to pause from what you're doing? Maybe take some deep breaths with me. That's fair and safe as long as they're willing participant. The other thing that everybody needs to do, maybe even before taking action on their physiology, is increasing their awareness of, why is this triggering for me? What are my triggers? How am I responding to this? Is this a learned behavior? Did I see this somewhere? Was this modeled for me? Most of our behaviors are learned behaviors. I mean, we're creatures of our environment and our family of origin and our gender and our, you know, there's so many different ways that show up in how we respond to those stresses, that increasing the awareness of what your triggers are and what your stress response is really important. What the 4-7-8 breath work does a lot of the time is, even if somebody doesn't know, hey, what is my response to stress? Then it will say, this is it. We're going to start catching this before it manifests as symptoms, and it will help increase your awareness. I know for a fact that my very first physiologic manifestation of stress is sweat. I just go from clean and dry to drenched in faster than you can know. And I'm still waiting, just for the record, for my nervous system to catch it before it shows up. I would love that if for some reason I could regulate before that happens. What I attribute it to, though, is that my body's going into survival mode, and then I come back to gratitude. Okay, if I really was in danger in that moment, then great, my body's kicking in the way it needs to. How do I step away from that then? How do I recalibrate? So I love the question, Ben. Providing options, providing ideals is great. The best course of action in that case would be, hey, do you know what's triggering you? Why is this upsetting to you? Can we start to do some reflection work? Because that's where the healing comes in. This is more of a hijack, if you will, how to really kind of
inviting awareness for them first, getting them into that state, and then triggering the breath.
Yeah, and breath work is great. I mean, even if they can do that in the moment with you, then awesome. If they're willing to participate and it doesn't exacerbate their symptoms, absolutely. Hey, let's just take some deep breaths together and come back to it. I think that would be great. Question about belly breathing and nose breathing. There's a lot of different science out there about what works best. For the physiologic hijack, I would say diaphragmatic breathing. So yeah, belly breathing, so pulling that diaphragm down, taking those full inhales. Nose breathing. So those are one and the same for me. You're breathing through your nose into your diaphragm or your belly. So yes. Interestingly enough, in Gray's Anatomy, the ultimate medical book of the world, and all of my physiologic textbooks, I've looked back and tried to find it. In no way, shape, or form is the mouth, our physical anatomical structure, physiologically ever indicated in the art of breathing. Crazy, right? In no way does it say this is what your mouth is for. It's not there to breathe. Your nose is there to breathe. That's why we have nose hair. That's why we've got mucus. That's why we've got turbinates. That's why we have sinuses. That's what the breath is for, is to capture all the nasty stuff we keep putting into our atmosphere and save it so it doesn't go down our lungs. Our mouth is for eating and speaking, not for breathing. So if you're a mouth breather, then you definitely want to get that looked at. Talk to your doctor. Of course. Thanks, Ben. I've got a patient in exactly 2.5 minutes, guys. So anybody have any other questions? Good? Okay. If you're shy, you have questions, info@cdahealingarts.com. You can always send a message, subject line. You can put it to Karin Duncan. After these presentations, I'm always willing to exchange emails for questions as it pertains to this conversation. Can't give out any medical advice, can't diagnose you, can't treat you, none of those types of things, but I can clarify or answer any questions that are pertinent to this if you have them. Thanks for being here, guys. Thanks for the amazing collaboration, participation. Always appreciate it. No, you guys did great. I appreciate it. Take care.